Inflammation is not always the enemy. Let's discuss. Hello, this is Dr. Siddharth Dambar, expert in rheumatology and regenerative medicine, physician here at Chicago Arthritis and Regenerative Medicine. So inflammation is frequently thought of as being a bad thing. Let's discuss some of the nuances involved in this. As a board-certified rheumatologist, I see a lot of inflammation in my patients. Generally speaking, we think of inflammation as a problem and one that needs to be suppressed. Let's discuss that in a little bit more detail, because it's not all bad. To simplify it, acute inflammation is your body trying to heal and recover from some kind of injury or environmental attack. Chronic inflammation is generally your body stuck in a bad cycle and an inability to get over that process. So first off, inflammation does not always mean autoimmune. Many of my patients with chronic systemic autoimmune issues, when they feel pain or they have any degree of inflammation, sometimes assume that it must be associated with their autoimmune condition. That's not always true. Inflammation can come from a lot of different sources. So first off, big difference between acute and chronic inflammation. Acute inflammation usually is your body's normal way of trying to repair or heal, and it's normally helpful. So think, for example, a sprained ankle. When you've had a sprained ankle, your body first creates inflammation in the area. That inflammation is meant to clean up any debris or infections that might be there, and to then start the normal healing process by bringing in other cells to then repair, remodel, proliferate, and eventually lead to healing of the tissue. That's a good thing and starts with acute inflammation. Another example would be, let's say you get exposed to a bacteria or virus. Your body may react to that to help protect you from that bacteria or virus. Another example is, let's say you get exposed to an environmental toxin that is not good for you. Again, your body may react to that to try to help protect you. Now, some acute inflammation can be too much and can be problematic. As an example, let's say you have a bad injury and you're having significant pain, really severe pain, that might be too much. Or let's say you have an infection and your body is having a severe response to it. It can be dangerous to you. Or let's say an exposure to an environmental toxin. It's not just the toxin that you're exposed to. Your body has an overreaction that can be too much, which can then cause some life-threatening issues as well. So within a reasonable range, acute inflammation can be helpful and protective. If it goes too far beyond that, you need to be treated to help keep things within a safe range. But in general, acute inflammation has a purpose that is meant to help you out. Now let's talk about chronic inflammation. Chronic inflammation typically is your body's incorrect and inefficient way of addressing some sort of issue. So for example, let's say you have chronic tendinitis in the shoulder. Well, you may have injured your shoulder several years ago, and inflammation at that time was okay, but now you're living with some chronic irritation and inflammation of the tendon. That is your body's inappropriate or inefficient way of addressing an area that it sees as weak or damaged. Or let's say someone who has chronic allergies. Again, an example of where there's an environmental exposure that your body does not know if that is dangerous or not. It's just reacting to it. It may be something that is very common in the environment, let's say pollen or some other smells or something else that now your body is overreacting to. It's an example of where chronic inflammation related to an exposure may be a problem there. Or chronic autoimmune conditions. Your immune system at baseline is meant to protect you from bacteria and viruses. In autoimmune conditions, what happens is that the body has some predisposition and then is triggered by some kind of exposure to now where the body is attacking its own self, thinking that it's actually foreign. Again, an example of where there's something incorrect that your body is doing or miscommunicating that is now leading to chronic inflammation, which is now causing issues. Now, even in chronic inflammation, you can have flare-ups that come up and down, but it's different than, let's say, an acute inflammation where your body is reacting to a very well-defined issue. In this case, chronic inflammation is fluctuating up and down, and again, doing so incorrectly because your immune system, for whatever reason, is overly stimulated or overly triggered and now causing a reaction. So again, inflammation on its own is not a bad thing. What's important is figuring out, is the severity of inflammation an issue or what is causing the inflammation? So in terms of severity of inflammation, again, if you have acute inflammation and let's say your body's overreacting and you're having way too much pain from, let's say, an ankle sprain, well, in that case, actually utilizing something to reduce that inflammation, let's say ice or an anti-inflammatory short term, is probably okay if it's in a limited form. But you shouldn't reflexively, after every injury, put ice on it because your body has to have a normal healing process as well. Another example would be if your body has been exposed to some sort of infection and it is having a severe reaction, more than just mild fevers and aches and pains, but something where now it's actually life-threateningly putting you at risk. Well, in that case, you may need treatment to help kind of suppress the immune system a little bit so that your body can not overreact and so you can survive that kind of exposure as well. Chronic inflammation issues are a little bit different. You need to treat the source of what's actually problematic. Let's say you have chronic tendinitis or chronic osteoarthritis, wear and tear arthritis in a joint, and that is causing some low-level inflammation that's causing pain. You want to treat what is the actual source of your problem. In the case of chronic tendinitis or chronic osteoarthritis, it's instability. So you want to do all the treatments that are meant to help with instability to actually help to recover from that sort of issue. What typically happens is in those cases, people are just taking chronic anti-inflammatory medications, chronic steroid injections. They're doing things to help reduce some of the inflammation, but they're not treating the source of the problem, which in this case is chronic instability. In the case of some other issues, let's say chronic autoimmune issues, look, if there is a very clear trigger for what's causing your issues, if it's food or environmental, and that's something you're able to figure out that helps to settle things down, wonderful, you should do that. In people that have more significant autoimmune issues, where there isn't a one defined trigger, then utilizing medication to modulate or kind of settle down their immune system is the right way to treat the issue because that's the source of the problem in this case. So inflammation on its own is not a bad thing. Understanding what's going on, the etiology, the trigger, and understanding whether this is an acute self-limited issue that is appropriate versus something that is chronic or over the top in terms of acute inflammation is what's key when it comes to deciding on how to approach and treat this. If you found this helpful, please like and subscribe to our channel. And any other questions, please contact us at chicagoarthritis.com. Thank you for your time and live well.